Hello guys, welcome back to my channel which is Real Homeopathy. Please do like, share and subscribe to my channel, and for more updates stay tuned and press the bell icon given below to get notified on each of my videos. So today let's begin the class with the case taking for a change, and this is a case taking by Pierre Schmidt. I hope I pronounce it very much of it rightly. And the case taking by Pierre Schmidt. And today I'll be explaining how to take a case in homeopathy, which is an acute case, especially how to take an acute case. So let's begin. So remedy which you should select. So which remedy you should select? So you should select a remedy which is from a mineral kingdom, vegetable kingdom, animal kingdom, or in ozodes. Okay, so if you consider this mineral remedy firstly, only then you have to begin always with a vegetable remedy. So whenever you want to give a mineral remedy, first give the vegetable remedy here. Always begin a case with a vegetable remedy. If it is in a acute case, I will even like to give you certain examples in the further slides. So the remedy you should select may be of a mineral kingdom or vegetable or a nosodes. So if you are considering a mineral before giving a mineral remedy, please try to begin the treatment of your case always with this. So only one exception to this is there, which is a lycopodium. Lycopodium, it is also the common name of it is club moss. So what it says, lycopodium belongs to vegetable kingdom. What they say is exception to this rule means only vegetable kingdom remedy, from that remedy only which you should not give is lycopodium. Which remedy you should not give is lycopodium here. So in acute cases you should not give this lycopodium. So as lycopodium is deep acting, so it is deep acting like that of calcarea and sulfur. It's a deep acting like that of calcarea and sulfur. So both of these, calcarea and sulfur, comes under a mineral. So these are deep acting remedies like that of these both, calcarea and sulfur. Okay. So let me explain the cases that which I have experienced. So case number 1 is a male aged 52 years came with severe abdominal pain and distension of abdomen, which is he is having a sore and offensive flatulence and erection. So with loose watery stools and unable to pass even flatus. So there was heartburn and continuous burping. Based on his totality of symptoms and his constitution, I gave him lycopodium 30. Oh my god. The case began to get worsen with the situation, and there was aggravation of all of his symptoms gradually decreased after so long of sufferings. That is acute case. So his abdomen was like completely distended abdomen. There was pain in his abdomen, and the patient is also very much of aged, 52 years. So think of that pain which he was bearing. So this was literally a hectic experience that I really had in my life. Totality of symptoms I gave based on that. Acute symptoms, you should not give lycopodium, but I gave that. The case began to worsen. Aggravations of all symptoms gradually decreased. At 4 a.m. in the morning, it gradually decreased, and he vomited out everything which he was having in his stomach. He vomited out the water which was there. There was projectile vomiting. So in order to avoid such aggravation in acutes, you should stop giving this lycopodium in acutes. Never begin an acute case with lycopodium, as it is deep acting remedy. Begin case with vegetable and then give other remedies like mineral kingdom, animal kingdom, or nosodes. Any of these you can give, but not deep acting remedies in the beginning of the treatment. Sometimes physician cannot know some things, and he cannot observe certain things. So what happens, some things the physician doesn't know what has happened with the patient. So the physician have to ask the patient's attenders and observe the patient's behavior also. He should ask patient's attenders, because some symptoms the patient he himself will not explain by himself, or he himself doesn't know what has happened. For an example, there is an epileptic attack which he got in the midnight. Even the patient doesn't know that he got epileptic attacks in the night time. He himself doesn't know. Only his attenders or any of his family members will be knowing that symptoms particularly. And when he comes to the clinic, first we need to observe his behavior. Okay, that was the first thing. Nextly, how to recognize a disease. How to recognize a disease, what type of disease it is. There is three kinds: symptoms, signs and accidents. What is a sign? Like signs of pregnancy, there is edema. Okay, these are the signs. These are physiological signs of pregnancy. Next, what is symptoms? Symptoms refers to disease condition, such like that of pathological signs. Like Hahnemann very clearly said that, opium produces constipation hard stools or constipated hard stools. So constipation is something and hard stool is something else. So both you need to understand what is constipation and what is hard stool. Both are very much different in the sense. Some have inactivity of rectum and have constipation, even with soft stools like that of alumina. Okay, they are constipated in quality and quantity as well. So this is a quality as well as quantity. So some have inactivity of the rectum. They are constipated. So careful that the physician should always be careful with this kinds of observations, that sometimes patients comes and directly says, I have constipation, I am unable to pass stools. So opium produces constipation following hard stool. So what we need to know about this is, opium produces constipation following hard stools. So there is inactivity of the rectum in that case. Okay, so opium produces constipation following hard stools. Nextly, what we need to know here is, need to know about the subjective and objective symptoms of the patient. What is the subjective symptoms here? Subjective means which is described by the patient himself. Objective which is observed by the physician. Okay, and next coming to accident. What is the meaning of accident now? It is a symptoms which has nothing to do with the chronic miasm. It has nothing to do with psoriasis, syphilis, psychosis or tubercular miasm here, but it is something which comes from an external source. Okay, example with that is burn hand, burn like prick of needle which gives an infection, or a sting from bee, or wasp is an accident. It comes from accident. So these are the examples. Taking a poison is an accident. It definitely has nothing to do with the vital force here. So these accidents which are here, these explanations which I have, examples which I have given, has nothing to do with the vital force. Here. Taking a poison is an accident. Getting burned is an accident. Sting of a bee is an accident, or a wasp is an accident. So it definitely has nothing to do with vital force. Everything happens to the physical body. If you take away the cause, the thing goes away by itself. So you have to take away the cause, which is the sting of the bee, or the poison you have to take out. So it has nothing to do with the vital force, or it has nothing to do with the main is the spirituality of the patient. But you cannot take something easily following grief or indignations. So following grief and indignation, these both come in the mental symptoms here. It comes under the mental symptoms of the patient. So these all are much more related with the vital force. These are related with the vital force. So this comes under the mental symptoms, psychosomatic conditions or psychosomatic aspects of the patients here. Every case is a new case and every patient has nothing to do with the old cases or even with the physician, nothing it does. So every case is a new case, every patient is new to the physician. So each one of them are different. They require different remedy or a medicine based on individualization. Individualization means each patient's reaction to the remedy varies. Each person's constitution is different, their temperament is different, their adaptation to the environment is different. So hence individualization means different state of the patient, different state of the patient here, as this mentioned by the Hahnemann. Next, coming to, allow patient to talk about himself, about his disease, about his mental conditions. Do not interrogate or interrupt his saying. So whatever he left, or even if you're having any doubt, then you can ask the questions when the patient completes about his speaking, about his complaints. Okay, you must know the patient's religion too. What is the patient's religion? You have to know about the patient's religion, um, and also his age, his occupation. Okay, you should know his occupation, his age. There are some things based on these. Some things will get to know age. Depending upon certain age, the patient will get the disease. Okay, depending upon the religion, the patient will get the disease. Depending upon the occupation which he do, whether it is in factory, whether it is in hospitals, or whether it is somewhere else, whether it is in any of the centers, how the disease came to him. So this is also depending upon the occupation what he do. There are some things based on these. Ask about the thirst of the patient. Whenever you take a case, the thirst of the patient is important. His thermals, whether the patient is hot, chilly, or ambithermal. Okay, these all the physician must know whenever he takes a case. Next, coming to perspiration, whether the perspiration is on palms, on soles, or on forehead, or on whole face. So this is very much essential to know the patient. Appetite, whether increased or decreased. Sleepless. Okay, whether the patient is sleepless or too much sleep, slumbering kind of thing, slumbering kind of sleep. Dreams of ghost, dreams of thief, etc. So such kinds of dreams, such kinds of sleep, such kind of appetite, such kind of perspiration. Urination, nocturnal enuresis, nighttime urination, nocturnal enuresis. Okay, stools, whether it is constipated or whether it is loose stools, loose, watery, or mucus. Color of the stools, smell of the stools, whether it is offensive in nature. Consistency of the stools is essential if the patient is suffering from any of these two states. Next, coming to menses. If it is in females, then menses you have to know whether it is irregular or whether it is heavy or scanty. Okay, profuse. Okay, sexual life, whether it is nil, whether the patient is not having any desire okay, all of such conditions, the desire is not there. Desire and aversion, what all the patient wants to eat. Desire for salt, desire for spicy, desire for chalk, desire for pickles, acid things, etc., sour things, all of it. Modalities, there is aggravation and amelioration. Whenever the conditions aggravate, when the conditions ameliorate. So this all is essential in modalities. Next, coming to important symptoms. Firstly, location. In which location the patient is getting pain. In sensation, in which location the patient is getting pain, in sensation, how is the sensation, whether it is throbbing type of pain, pricking type of pain, stitching type of pain, lancinating pain, pulsating, okay, spasmodic, etc. Next, coming to modalities, I have said here modalities here. Modalities, aggravation, remuneration, same is here. Concomitants means associated symptoms along with vomiting. There is headache. So headache is considered to be as a concomitant symptom. Okay, always begin case with vegetable kingdom and later give mineral, animal nosodes, etc. in acute, but always begin a case with vegetable. So this is all I just wanted to say you about the case taking which is done by the Perry here. So the case taking is by Perry, and I just want to thank you, all of you, for watching this video, and I just hope you keep on supporting me and share this video, and if any doubts, then please put in the comment section below. Thank you.